When people come see me in consultation, a fair number of times the question comes up is when should I, if ever, consider the use of donor eggs? And donor eggs are to be utilized in the event that a woman has poor egg quality. Poor egg quality tends to be caused by advancing female age. And what that means is that as a woman gets older and she releases an egg when she ovulates, as she gets older, there's a greater chance that the egg that she releases is going to become chromosomally abnormal. And this starts really subtly at about age 31. It starts rising more exponentially after age 35. So there's a greater chance of releasing chromosomally abnormal eggs beyond the age of 35. And so really the reason for use of donor eggs is advancing maternal age, advancing female age. But it becomes kind of a relative thing. When people are usually getting to the point of thinking about egg donation, they've also been taking advantage of IVF technology, going through an in vitro fertilization cycle. And a chance of a couple conceiving on their own that have no fertility factors at all, including female age, is about 20% per attempt, 20% per cycle. With things like in vitro fertilization, we can actually do better than that, but it's related to female age. A woman that's under age 35, typically the chances of conceiving with IVF may be 60-65% per attempt. Age 35 to 38, about 50%, 38 to 40, about 35 to 38%, 41 and above, drop down to about 20%. And so what I always want patients to do is take into account all the costs that they have to go through by doing this reproductive technology. And cost isn't just financial, even though that's obviously very important. There's also physical and there's emotional costs as well. The financial cost is an obvious one. The physical cost means how many office visits, how much inconvenience by coming in here, how many procedures to go through, blood draws, ultrasounds, procedures like egg retrievals, embryo transfers. So there's a lot involved just physically. It takes quite a physical toll. And finally, there's the emotional cost. A lot of people don't think about whenever they, though, undergo any of our technologies, if it hasn't been successful, it's very demoralizing. So there's the physical, financial, and emotional cost. And so it's important for patients to put those costs in the context of what their chances are of conceiving. And as they get older, those chances, as I mentioned, start to fall. And so patients kind of have to help me out at what point is there a tipping point of when it makes more sense to them to have a much better chance of conceiving per attempt. And I have patients that are maybe in their mid-40s and may have really less than 5% chance of conceiving. But understanding all the things they have to go through, to them, it's worth it to go through all those things to have this 5% chance of conceiving with their own eggs. Some younger patients who have a much better chance are frustrated, have a limited amount of resources, and just are being very pragmatic and would like to have the best technology to offer them the best chance of conceiving in the shortest amount of time. And so generally the use of egg donation is for poor quality eggs. Poor quality eggs are related to advancing age, but really it's important to take into account all those factors, the costs you have to go through, physical, financial, and emotional, and decide what's most appropriate for you.